ELISA stands for enzyme-linked immunosorbent assay. ELISA is a labeled immunoassay where the antigen or antibody is labeled with a reporter enzyme. Recall that reporter enzymes produce a color change when the enzyme reacts with its specific substrate. Thus in ELISA, color change is used to identify a substance. This assay is used for the detection and quantitation of substances such as peptides, proteins, antibodies, and hormones. There are three main formats of ELISA. These are direct ELISA, indirect ELISA, and sandwich ELISA. In this video lecture we will study direct ELISA. In the previous video lecture, we understood the difference between the term direct and indirect detection assay. Easiest way to remember the difference between direct and indirect ELISA is to look at the enzyme-linked antibody. If enzyme-linked antibody is directly binding the antigen, it is direct ELISA. And if enzyme-linked antibody is not directly binding to the antigen, then it is indirect ELISA. As you can see here, in indirect ELISA, the enzyme-linked antibody binds to the antibody already bound to the antigen. Let's now understand the steps involved in direct ELISA. Direct ELISA is used to detect antigens in the test samples. Test result can be positive or negative depending on the presence and absence of the antigen in the test sample. Suppose we have serum samples from two patients, patient 1 and patient 2. For our illustration, we assume that antigen is present in patient 1 and absent in patient 2. Let's see how to detect and confirm this by ELISA test. We will take two microtiter wells, each corresponding to the patient's serum sample. So this is 1 and this is 2. In the first step, the antigens present in the patient's serum are adsorbed and immobilized in the microtiter well. No adsorbed antigens are shown in the well 2 because the target antigen is absent in the serum sample of patient 2. Note that we are not showing other antigens present in the serum of patients. Both these microtiter wells are rinsed to remove any unbound antigens present in the well. In the second step, enzyme-linked antibodies specific to the target antigens are added in each well. These enzyme-linked antibodies will bind to their specific antigens in the well, if they are present. Thus, here you can see that antigen-antibody binding takes place in the first well, and no antigen-antibody binding takes place in the second well. This is because there was no target antigen. Each well is rinsed again to remove any unbound antibodies. After rinsing step, only antibodies present in the first well are those bound to the antigen, whereas no antibodies are present in the second well. In the third and final step, we add substrate specific for the enzyme that is linked to the conjugated antibody. After some time, color development can be seen in the first well. This is because the enzyme linked to the antibody acted on the substrate and resulted in the formation of colored end product. But in the second well there is no color change. This is because there was no enzyme-linked antibody present in this well. Thus, in ELISA test, a color change reveals the presence of the antigen. This is termed as a positive test. No color change indicates that the antigen was not present in the test sample. This is termed as a negative test. Thus, direct ELISA detects the presence of antigens in a test sample. It is commonly used for immunohistochemical staining of tissues and cells. That's all in today's lecture. In the next lecture we will study indirect ELISA. Thank you for watching.